Good afternoon. I've got 2 o'clock. So we're going to go ahead and get the webinar rolling. This is Victoria Beal with the Ohio LTAP Center, and I'm very pleased to be able to host for you this afternoon a webinar that's actually going to be presented by Sally Sharrow, and she is with Tool Design Group, and she's going to be presenting not only on behalf of Tool, but the Ohio Department of Health, and they're creating Healthy Communities program and ODOT and our active transportation program and academy, and I'm with the Ohio LTAP Center, which is located here at ODOT, and we do training and technical assistance for our local public agencies in Ohio. And one of the things we offer are webinars, and we're happy to have you on here. A couple of housekeeping items, and then I'm going to turn it over to Sally for her to get things moving. On your screen, you should hopefully see a chat pod on the left-hand side. If you do not see a chat pod, look for a circle with a thought bubble in it, and click on that, and hopefully the chat pod will appear. This is how we're going to ask for you to communicate with us for questions during the actual webinar itself. Now, I will open the phone lines up for questions at the end of the webinar, but any questions you have during the webinar, please feel free to put them in there, and I'll read them off to Sally so she can go ahead and provide you an answer. So the other thing is I am attempting to record the webinar, but please don't let that dampen your enthusiasm for asking questions. We're doing that for those who may not have been able to participate so they can view it later. But you are the fortunate ones who are here and participating, in person on the webinar. So we're happy to have you. And Sally, are you ready?
I'm ready. Can you hear me?
Sure can. Thanks.
All right, great. Thanks, Victoria, for the introduction, and we're really grateful to ODOT for hosting this. And as with all these other webinars we've done, it's a great example of collaboration between state agencies with ODOT and ODH, so we're really happy to be a part of that. This is the third in our series of webinars about the intersection of land use and health. So our first one we did was a sort of land use 101, which was an overview of the basic idea of land use and how it can affect public health. And then our second one looked closer at land use and health issues in rural areas. So today we're going to be taking another look at health issues, but this time in urban and also suburban areas to some extent. So this is today's agenda, and we will have a handful of interactive polls during the presentation, which are going to help us guide the conversation. So if you could have your phones ready or just a regular internet browser to respond to those, I'll be looking forward to seeing your answers, and I'll give you more instruction on those when the time comes. We also have some learning objectives for today, so we're going to be reviewing the basics of land use and transportation planning principles. We will talk about the land use and health issues particular to urban and suburban areas, and we will talk about land use strategies for promoting health in urban and suburban areas. And I apologize if there's some background noise. I'm sitting right off of High Street here in Columbus, but I like to think we're just sort of setting the tone for our urban discussion. So apologies if you hear some sirens. As Victoria said, my name is Sally Sharrow. I'm a planner with Tool Design in Columbus. And I'm also one of 3 regional outreach coordinators who provide technical assistance related to active transportation under our contract with the Ohio Department of Health. So our team leads trainings, workshops, town halls, and develops a bunch of resources for all of the different Creating Healthy Community coordinators in Ohio. So I've gotten to work closely with a bunch of different Ohio communities on their land use and health strategies. The services we provide to communities through the Department of Health are funded by the Centers for Disease Control and Prevention, so I'd also like to acknowledge their contribution and thank them for their ongoing support. These webinars really serve as a preview for a series of land use and health workshops that we're doing that are open to the public, and we're really excited to lead these workshops as part of our contract with ODH. And so we've partnered with NPOs around the state to bring them to different local communities. So everyone is welcome to attend. I especially encourage you to attend if you're a health professional who's maybe not so familiar with land use, and to bring along a local planner or transportation professional, an elected official, any sort of decision maker who's dealing with land use issues, because this could be a really great opportunity to start building important relationships between health and land use professionals. So our next workshop will be on June 19th in Dayton, hosted by the Miami Valley Regional Planning Commission. So you can find, we can share information about that. And then on the 23rd of July, Buckeye Hills will be co-sponsoring a workshop in Marietta. And we are finalizing dates for some future workshops, which will be in Lima, Central Ohio, and Southern Ohio. And lastly, before we dive into the topic today, I want to remind you or let you know about the Land Use and Health Best Practices Report, which we produced that covers a lot of the issues discussed in these webinars. So CHC coordinators have already gotten copies of these, and we'll be able to share that report as well on the CHC website in the coming months. But that report covers some of the Land Use 101 content that we talked about in our first webinar and that we'll touch on today. And it also goes into a lot more detail with a set of Ohio case studies. It highlights communities that have effectively used land use and design strategies to improve health outcomes, and talks about those strong cross-sector partnerships between health and land use professionals. We also are currently finalizing our Land Use and Health Implementation Guide, which is really a companion to this report, and it's designed to help communities dive into that real meat of doing the land use planning and zoning. And it's especially geared towards public health professionals who maybe don't make the land use decisions themselves, but are really interested in influencing that process. So it talks about how to create or update zoning and health practitioners' roles in that process, and includes a bunch of really great model zoning code language and resources, and just ideas that you can start to implement in your communities. So some of the materials in today's webinar also touches on this report. So to get started, I'd like to do our first interactive poll. So I'm just interested to know who's on the phone today, and if you attended the first webinar in March on Land Use 101, or if you attended the second webinar on May 22nd on Land Use in rural areas, and that will sort of help me know how much detail to go into some of this background information. So if you can go to the website menti.com and use the code 357460, you should be able to see that question either on your phone or on your browser and answer it. So I'm going to escape out of this presentation for a sec so we can see our results. And again, the
I think there might be a different code there.
Oh, there might be a different code. I'm so sorry.
Yeah.
Please use the code that's on the. Please use the code that's on the screen right now.
874675.
Yeah. Sorry about that. So. Yeah, let me know if you attended Land Use 101 or rural areas or both. And don't forget to hit submit. Oh, got a bunch of people on there. There we go. All right, so we have a bunch of people, new people who did not come to either of those, and then we have a few repeat customers, so that's great. We'll be able to share some new information with the people who came to those others, and then give everybody else a good basis. All right, it looks like people are done entering their answers, so we can go back. There we go. Okay, so land use for urban and suburban communities. The way that land use and transportation shape our built environment is really inextricably linked to public health outcomes. Planning and zoning basically grew out of a need to address issues of public health. So over the last couple of decades, there's an increasing acknowledgement or sort of re-acknowledgement of this fact, and there's been a lot more emphasis on the links between transportation, land use, and health outcomes, especially at the federal level from organizations like the CDC, the US DOT, and other agencies, which has meant that there's more and more grant funding also focusing on the intersection of those issues, which is great for communities. And I'd like to start today's presentation just with a quick recap of some land use and health fundamentals from the first webinar. So for those of you that did not attend that webinar or who want a refresher, the slides and recordings of that first webinar are available from LTAP, and you can go back to see that, or you can look at our report that I mentioned. Land use is the practice of how communities manage and modify their physical space. And its main purpose is to ensure that a community's to ensure a community's economic, social, and environmental strength. So not only does it regulate our built environment, which includes buildings, roads, and other infrastructure, it also shapes the natural environment and can be used to reserve space for parks and trails and recreational uses within cities, or to preserve the natural systems that help keep us healthy. In Ohio, land use is the responsibility of village, township, city, or county governments. So today, when we're talking about urban issues, we're mostly thinking about village and city governments. And decisions about land use are often made as part of an extensive public process, including input from community members. So this might occur during a comprehensive planning process or a comp plan update, which is there to guide all the aspects of a community's long-term change. Land use policies can determine where different activities such as living, working, and recreating best fit within a community, and they can also regulate how buildings and sites should be laid out and configured. So for example, a zoning code could require that a sidewalk-oriented building entrance to encourage pedestrian activity rather than having entrances that just face onto parking lots. Or on the flip side, zoning codes can prohibit certain uses within zones which separate residences from jobs and services, which can actually increase trip length and reduce the ability to walk or bike. So land use can really play to one side or the other of these needs. And we'll talk more about this later, but that can give you an idea of the power of land use to shape our daily habits and preferences and really shape how we interact with the built environment. Land use planning is a crucial opportunity for local governments to shape public health outcomes. It's one of the biggest tools that they have to do this, because it shapes the way that people live, what forms of transportation are available, and what amenities they can access. Land use can also affect environmental health. So allowing noxious land uses to locate near developed areas can cause major hazards to community and environmental health. And a noxious land use would be a landfill or a heavy industrial site which produces hazardous materials and can contaminate the surroundings. So even something like a highway, ODOT, can be a noxious land use in certain circumstances because they burden adjacent communities with adverse air quality, noise, or traffic safety, and other problems. And in addition to the problem of noxious land uses, land use regulations can have a less direct but also adverse impact by permitting low-density development, which encourages travel by car, which increases exposure to pollution. So it's really changing how humans interact with the environment and the effect they have on it. Planners always use this graphic to illustrate all the different types of built environments that we live in. So it's called the transect. I'm sure some of you have seen it before. And it talks about really the different zones of human development, which range from an urban center and downtown core all the way out to a rural or natural zone. So today's webinar, we're going to focus on the zones to the right, which are the urban core, urban center, general urban, and then to some extent we'll talk about suburban as well. And while these zones have their differences in how they look, they also share a lot of common challenges. So as you might imagine, each of these different land use contexts has its own set of health challenges, and there is some overlap in certain categories between the sort of urban to suburban to rural areas. But there's also health challenges that are unique to each of those communities. And today we're going to focus on, again, those unique to urban communities, as well as the ones that they share in common with suburban communities. And then if you want a little bit more detail on some of the land use and health challenges that suburban communities share with rural communities, you can look at the last webinar, which also has the recordings available online. So we've talked a little bit already about urban versus suburban versus rural, and I'd like to know what type of community you live in or work in. So again, we're going to go back to the page, and you should have the same site available, but if you need to enter the code again, you can. And where's my mouse? There we go. So yeah, let us know if you're living or working in an urban, suburban, or small town or rural community. All right, we got a lot of suburbs. Okay, cool. So we've got the majority is, or the plurality, I guess, is suburban and urban as well. And then we do have some folks from small town or rural. So hopefully this information is still relevant to you, because your small town, at the end of the day, probably has some urban aspects to it. So thank you. There we go. Okay, so you might have looked at this question and asked, hey, what exactly do you mean by urban? And that's an important question to set the stage. According to the census, urban areas are densely developed territories encompassing residential, commercial, and other non-residential uses. So that's a pretty wide idea. I think the most important thing there is densely developed. And the images on the screen are some things you might associate with urban areas, some of those taller buildings, the dense building environment, maybe more urban parks. But when you really try to get to the definition of urban, it can get a little trickier. So again, under the census, you have urbanized areas, which are areas of 50,000 or more people. So these are really your core cities. And these form the basis for metropolitan statistical areas, which includes both that urban core and its surrounding suburbs, which are related to the urban core based on commuting and economic relationships. And these metropolitan statistical areas also dictate the boundaries of a metropolitan planning organization, and that's required by federal law. So the MPO we'll talk about a little bit later, but that's going to be the organization that's really shaping planning as a region in that area. The census also identifies urban clusters, which have 2,500 people all the way up to 50,000, which is a pretty big range in size. A lot of those might fall more into the small town definition. And those form the core of a micropolitan statistical area, which again is a sort of regional idea of people commuting and relating back and forth between an urban area and its surroundings. What about suburbs? There really is no true definition, at least in the census, of what a suburb is. So they're going to be encompassed under the metropolitan statistical areas. So they're sort of considered in part of this urban area, but they have their own unique challenges and patterns. And then you might also have heard the term exurbs, which tend to be more affluent communities, which are out beyond the suburbs, but wouldn't necessarily be considered rural areas. So we're dealing with a wide variety of areas here. In the United States, we are an urbanized nation. As of 2010, 81% of the population lived in these two different urban areas as defined by the census. But urban areas only take up 25% of our land area. So it's a much larger percentage of the population living on a smaller percentage of land, which is how you get density within cities. And the map on the left is all of those urbanized areas and urban clusters as of 2010. In Ohio, we are slightly less urban population-wise than the nation. We are 78% of our population lives in urban areas. And we're living on, those of us who live in urban areas are in an even smaller percentage of the land area, so only 11% of Ohio's land is within those urbanized areas. So we have a larger sort of land mass that's rural, and our cities are taking up a smaller part. And on the left, you can see all of the urban areas within Ohio. So now we have definitions out of the way. I'd like to get your thoughts on what some of the challenges you think related to health and land use that you encounter working or living in these areas. So what are some of the challenges for urban and suburban communities? And you should be able to just type in some ideas. You can submit more than one, and just be sure to hit submit when you do. Okay, affordable housing, that's a big one. Resources, so transportation, the bus doesn't go places. The suburbs, the need to drive places, longer commutes. Yeah, these are all big ones. lack of transit, pedestrian connectivity, access to food. Let's see, can we scroll down? There we go, lack of diversity, lack of ped facilities, access management. Okay, yeah, we've got a lot of good ideas up here. Access to jobs and opportunity, transportation, yeah, a lot of good ideas up here. Anybody else have any other ideas they want to put? Okay. Thank you for sharing those. So yeah, some of the things. Sorry, this is tricky. Okay, so yeah, some of the things that you mentioned are definitely pretty uniquely urban challenges. A big one that there was one mention of diversity up there. Demographic changes are really a big thing happening in our urban areas right now. We're becoming more urban every year, and also the demographics within our urban areas are shifting. By nature, Ohio cities really have the most diverse demographics within the state, and that also means they have some of the most pronounced health disparities. And they're becoming more diverse. So this research from the Pew Research Center shows that those counties in the country that are majority urban no longer have a single racial or ethnic majority. So really, we're seeing a much different makeup of people in our cities. We also have an aging population in the country as a whole. Urban areas maybe have a less pronounced aging population, but it's still creating a demographic shift within our communities, and it's also creating different demands for what people want and need to see within their communities as far as housing and transportation. There's also a trend of the suburbanization of poverty, so the sort of stereotypical image is of the sort of wealthier, whiter suburbs. That's no longer always necessarily the case. The number of poor residents has increased the most in suburban areas. So we're seeing this shift of impoverishment to the suburbs in an area where there is less access to transit and other resources, which is an important thing to consider. Another challenge is thinking about shrinking cities. So in Ohio, shrinking cities, I think, are on a lot of people's minds. These are cities that are losing population. And though these are urban areas, they're going to have a much different set of challenges than those cities that are growing quickly. Even as we continue to urbanize, a lot of cities are losing population. So this can lead to vacant buildings and land. Often that vacant land can be toxic brownfield land. There's a lack of funding to maintain the infrastructure that's already there in these cities. There's lower water demand, which actually I just read this is interesting, that when there's less demand for water, then there's less water flowing through pipes, and that can lead up to a buildup of more microbes in the water, so it's affecting water quality. There is a much more pronounced aging population in shrinking cities, and there's often underemployment and lower incomes within these cities, so just a lot less access to resources. On the flip side, communities that are experiencing growth can face challenges of gentrification and displacement. And this isn't necessarily only communities that are growing. It might be an area within a shrinking city that is growing in itself or experiencing development. So often the rise of compact and mixed-use development within an urban area can push existing residents out of that revitalizing area because there's higher rents, increased police presence, and other factors. Introducing bicycle lanes and other active transportation facilities can often even be used as a tool to attract young, wealthy, and white people to gentrify those neglected neighborhoods and spark redevelopment. So again, this is probably more of a concern in your growing cities, but there's gentrification happening in Columbus, but there's also gentrification happening in Dayton and in a lot of other places, and this leads to displacement and housing instability. And then suburban sprawl, so really thinking about that edge of the city and the suburbs. Without any limits on our outward growth, we continue to see the continued low density and greenfield development out on the edges of our cities. This is often because the relative cost of developing on an undeveloped greenfield site is a lot lower than redeveloping or doing infill development within a city. And there's also a lot of competition between jurisdictions, which can lead to a sort of race to the bottom with people competing to bring businesses, and with that leads to a lack of will to do good planning when these businesses are coming in. As a result of all this sprawl, we have to build more roads, we have to spend more to upkeep that infrastructure, and we also are seeing, again, the continuation of sort of auto-oriented communities that are not conducive to healthy and active living. So that covers some of the challenges of working and living in urban and suburban communities, but I'd like to hear from you what you think some of the benefits. What are some of the great things about working in an urban community, especially as it relates to supporting people's health? We will go back here. And again, please enter as many ideas as you can think of about the benefits and strengths of urban, and I should say suburban communities, sorry about that. And we will be sharing the results of everything that you shared today at the end, and Victoria will publish those online so you can see some of other people's ideas. So yeah, some benefits. Proximity to social support, that's a big one. A strong sense of community. What are some other health-related strengths? Social opportunities. Don't forget to hit submit if you're entering an idea. Connection to resources. Yes, hospitals, doctors, jobs, and libraries. Certainly easier to get to when you're in an urban area. Mixed use, yep, for sure. Feeling safe. Sidewalks, that's a big one. I can spell this down. Multimodal transportation, yes.
We had a comment come in through the chat pod too, a community garden.
Community gardens, yes. All right. I think I can't. Okay, cool. Well, thank you all very much for sharing these ideas. Those are definitely a lot of benefits of having a concentration of people and resources in one place. So we are going to talk a little bit more about that. Okay. So some of our urban strengths that you've already mentioned. Especially when we're talking about our older cities in Ohio, they began development at a time when active transportation was really the only transportation. So they were built in a way that really is much more supportive of active transportation. And are just more walkable sort of by the nature of how they developed. They also have a mix of uses, as somebody mentioned, that's often sort of grandfathered in from older periods in our development or has been sort of encouraged in more recent times. And transit and active transportation, a couple of people mentioned, cities are the areas where you have enough population to really support a robust transit system, or where there's enough uses that are close enough together that you could feasibly walk or bike to them. Another strength somebody mentioned is access to services. So I think that person mentioned a bunch of things like doctors and libraries and hospitals and businesses, which are all important, but yeah, you don't have to go nearly as far to access your health services. There's a variety of businesses and food options, maybe not in every single neighborhood, but there is sort of more options for eating healthy. There's access to employers and a wider variety of employment opportunities within cities most often. And then I think resources is also a big one, and this is obviously going to depend a lot on what city you live in, but cities might have a larger budget for a smaller land area than something like a county who's trying to deal with some of the same issues. You might also live in a city that's a center of regional or state government. So obviously this is the Ohio State House. Columbus has a lot of access to power at that level, but even a county seat or wherever your metropolitan planning organization is located, those are also just areas where you have that much more direct access to those decision makers. There's also just a lot of people power in cities. There's a lot of people living in cities that can be mobilized and organized around a cause. And there's a lot of, when we talk about resources, the existing infrastructure that already exists in cities that doesn't have to be rebuilt is a big resource as well. So we've talked a little bit about the challenges and the strengths, and I want to get a little bit more specifically into talking about the specific health challenges. If you remember that chart we showed at the beginning, there's some specific health challenges that really are prevalent within urban and suburban areas. So on this particular graphic, the orange ones are the urban challenges, and then the red ones are the ones that are also a little bit more specific to suburbs, which we'll touch on a bit as well.
Sally, there was a question that came into the chat pod that I think would be very appropriate here. One person wanted to know, what are people in other areas doing to deal with water microbes in shrinking cities?
Yeah, that's a great question, and that's something that I just learned about when preparing for this presentation. And I know that a lot of cities are dealing with questions of, do we maintain all of our infrastructure in our entire city, or do we need to make decisions about where to scale back on it? So I don't have any specific examples. If there's anybody on the call who's working in a shrinking city and has thoughts, I would love to hear from them as well, because that's a major piece of infrastructure that you would have to deal with. So if anybody has some thoughts that they want to put in the chat box for that'd be great to hear.
That's wonderful. And then we did have another person who I don't think quite caught the instructions at the beginning about how to respond with the Menti. So if you could let us know if you have another one of those coming up, what the code is so they can connect through their phone or their browser to the Menti to do the responses, that'd be great.
Yes, definitely. And so, yeah, sorry about that. And the number got mixed up there. But yeah, we will have, I think, one more opportunity to participate in that. So that will be at menti.com, and then I will be sure to share the number again and give people a chance to log back into that. Thank you for those. So yeah, I'm going to just talk a little bit. I'm going to go through each of these different challenges and talk about the challenge itself, and then some of the land use tools that are available to address those challenges. As we're going through these, I also want everyone to keep in mind these 4 principles for designing for health, which really should be a guide for all of this discussion and information. So our 4 principles, and we have some information about this in our original report as well, are to design to increase physical activity, design for mental health, design for children, and design for environmental justice. So planning with these principles in mind helps keep communities compact and less auto-dependent, which can decrease segregation by age, income, and race, and also help develop social and cultural capital. Residents spend less time commuting to jobs, they spend more time with family members. It also can provide more opportunity for walking to destinations, which can increase physical activity. It can decrease ailments associated with inactivity, improve air quality, and decrease respiratory problems. So that's a lot to take on, but having these 4 principles sort of running throughout all of your thinking and planning around health are really important. And I mentioned the Land Use and Health Implementation Guide earlier on, but a lot of the examples that I'm going to touch on today are described in a lot more detail in our upcoming report. So we will be sure to share information when that is available, and all of the CHC coordinators will have easy access to this. And so you'll be able to learn in a lot more detail about some of the examples I'm going to touch on today. All right, so healthy food access, this was one that somebody mentioned in our poll. And having better access to healthy foods has been associated with better eating habits, decreased risk of obesity and other chronic diseases, But in urban areas, especially, healthy food is often absent, especially in communities of color and low-income areas. So I'm sure a lot of you have heard of the idea of a food desert. There's areas where there's just not locally available healthy food to eat. So what are some of the tools that communities can do to address this? Healthy food ordinances are a major one. These would be local laws to facilitate the production and sale of local food, or to limit the availability of unhealthy foods or increase the availability of healthy foods in the community. Rezoning or adding provisions to a zoning code to allow agriculture in urban areas and facilitate animal husbandry can promote local production of healthy food. And then land banking sort of goes hand in hand with that, but the city or the county holding on to vacant land parcels and transferring them to use for community gardens can be a really great tool in urban areas, and especially in the shrinking cities. We also have a Safe Routes to Healthy Foods fact sheet, which went out to the Creating Healthy Community coordinators in January, and that goes into more detail about how the built environment affects access to healthy foods and what strategies can be used to improve access, which includes improving bike and pedestrian and transit connections to healthy food resources. So that's another piece of information that we can share, or that you can talk to your CHC community coordinators about. So this is a case study that I've been hearing about a lot in the news lately, and it's about the Healthy Neighborhoods Overlay in Tulsa, Oklahoma. So this is a zoning district overlay that was put in place to address some issues that they were finding in Tulsa. They found that dollar stores were in overabundance, and that was really limiting the possibility of grocery stores to survive. So dollar stores were sort of underselling grocery stores, and they were just everywhere and making it really hard for the groceries to survive. So the goal of this overlay was to encourage a bigger variety of retail options with convenient access to fresh meats, fruits, and vegetables. They also aim to reduce the oversupply of those corner stores without fresh foods, promote grassroots access to fresh food, and to use a more community-based approach to purchase and distribute fresh foods in specific neighborhoods that had this problem. So within the areas that have this overlay, it permits on-site sale of community garden products by right. So anyone who has a community garden doesn't have to ask special permission. They can sell their products right there at their garden. It also reduces grocery store parking requirements by half. That's a huge barrier to starting a grocery store, is needing to get enough land to fulfill parking requirements. So this really made it a lot easier to have those sort of more urban footprint grocery stores. It also requires a minimum of 1 mile between small box discount stores, so your dollar stores, because those stores typically don't offer fresh food. And when they did this in certain neighborhoods in Tulsa, they mapped out a mile buffer around every dollar store, and they found that there wasn't going to be any more locations where those dollar stores could locate. So really there was such an overabundance, and by using this distance requirement, they were going to limit the number that was going to be able to open up further stores. I'm not sure that this has gone through any litigation, if it's been challenged, but it's been a really promising example of how to combat that.
There was a question that came in the chat pod.
Yeah.
Someone wanted to know if you could share the name of the case study, please.
Yes, so it's the so it would be the Tulsa Healthy Neighborhood Overlay District from Tulsa, Oklahoma. And we could share a link. I could share a link to some stories and the actual code that is found in.
That'd be great. If you send that to me afterwards, I'll make sure to send it out with links to the recording and the PDFs.
Yes, will do. Another case study is of Cleveland. So Cleveland does a lot to facilitate urban agriculture through its zoning code. So for one thing, it allows a variety of animals for urban agricultural use, including beekeeping, on lots that are greater than 2,400 square feet. It also has an urban gardening zoning district, which allows land to be reserved for garden use through their zoning. And it permits the use of market gardens and urban gardens in those districts. And then it permits agriculture on vacant residentially zoned lots, and it allows the sale of produce, again, from farm stands as a conditional use. So you would have to request permission, but you would then be able to sell produce locally. And then finally, larger scale farming is permitted in the urban agriculture overlay district. So that would be another zoning district within the code that would say you could have a larger scale farm. So the photo here is of the Great Lakes Ohio City farm, which I believe is permitted under that district. If anybody happens to be on the call from Cleveland today and has experience with that they want to share, that would be great to hear. So loss of farmland or sprawl. So this is, we were talking about this a little bit more as a suburban issue, but really it's about the outskirts of the urban area. And the loss of that farmland on the outskirts of the city means we have less access to locally produced foods. Food has to travel a lot further to get to us, increasing pollution. And then also urban sprawl can encroach on natural habitats, which promotes environmental health. So as cities are growing, the value of farmland continues to increase in those areas near the cities where utilities are being extended. So it becomes a lot more profitable to sell a farmland off for development than to continue farming. So without any limits on our outward expansion, cities continue to extend their utilities out, and developers are going to continue to find it cheaper and more attractive to build on the edges of the city. So some of the tools that can be used to help combat sprawl and maintain that agricultural land are on the screen. So conservation zoning is a big one, and that protects open and undeveloped land while allowing concentrated development in certain areas. So a conservation easement would be an agreement between a property owner and a land trust or some other organization where the property owner agrees to put restrictions on the use of their property to protect natural resources. So that's just an agreement that says I am agreeing not to develop my land for a certain period of time into the future. Transfer of development rights would be another tool, and that's the one shown in the image. And this allows landowners in lower density areas to voluntarily put a limit on their development on their land because they've sold off their right to do so. A developer then buys those rights and uses them to increase the density of development in another area that's planned for growth, so maybe in a town center. So this is a really pretty common mechanism for protecting farmland and natural resources, and then at the same time it increases density in the suburbs by transferring that sprawling development into a more concentrated and dense area. And then finally, just making it more attractive to build infill development versus greenfield development. This can be done through incentives in certain areas where you want to see infill growth, or it could be done by limiting the expansion of utilities to areas outside of the city. And we have, I'll be sharing case studies for a few of these items, but again, in that report that will be coming out soon, there's a lot more examples, but I just wanted to concentrate on a few of them today. So poor air quality is another big urban health challenge. In North America, 125 million Americans live in municipalities with unsafe levels of air pollution, which is a huge proportion, and vehicle emissions are really the main source of outdoor air pollution, which is also on the rise. In 2008, over 800,000 adults and 250,000 children in the U.S. had asthma, which is usually attributed to air pollution. And those numbers are always skewed toward by race and income as well. So asthma is a huge public health problem related to pollution, and pollution is very directly related to land use. So getting cars off the road and adding urban vegetation are some of the best ways to combat that poor air quality. So expanding our transit availability and promoting active transportation are two major ones. Also using road diets and other policies to reduce the width of our roads rather than increasing them, which induces more demand for using cars. Congestion pricing is also another thing that some places around the world are exploring to charge people for the privilege of driving in certain areas. We can also promote the urban tree canopy which helps mitigate pollution. That can be done through urban forestry programs. It can be done through development guidelines that require more vegetation and trees on new sites. And that value of promoting the urban tree canopy or promoting transit or active transportation should really be brought into planning in the community at all levels. Poor water quality is another major urban health issue. As we develop our cities, we're sending more stormwater into our water systems. We're causing more combined sewer overflow events, which contaminates water, which might be water that we want to use for recreation, or is contaminating the natural systems. So really, green infrastructure is one of the biggest tools to face this, which can help manage stormwater runoff through rain gardens like this one, or catchment basins, or a lot of other processes. So Columbus has their Blueprint Columbus project, and they've developed green infrastructure design guidelines. So this is guiding how green infrastructure is developed within the publicly owned right-of-way, but it can also be used on private development sites where appropriate. And I think that's where it's really important to share these guidelines widely and encourage private developers to be including this kind of project in their plans. Lack of physical activity. So most Americans do not get enough physical activity to keep us healthy. Much of this is due to, again, to urban environments that force us to commute to work in our cars and sit at a desk all day and not incorporate activity into our daily lives. So the Centers for Disease Control have a set of physical activity guidelines that they recommend to promote just basic level of health. So they are available there's guidelines for different ages and how much activities people should be doing to stay healthy. And all of this can be promoted through better land use practices, which might include some of the ones on the screen. So walkable development site design guidelines or requirements. These are an opportunity to work with developers to make developments that are more walkable. These might include site design guidelines such as access to the sidewalk, placing parking behind buildings, requiring that street grids continue through a development. And so that's how we can work with new developments to focus on walkability. Infill development as incentives, again, we've talked about a lot, but the more we develop in areas that already have other buildings, the more walkable our destinations will be. Transit-oriented development or a corridor approach also can be facilitated to encourage people to live and work in areas that are near easy access to transportation so that they don't have to use cars. Reducing parking minimums within our codes is also a big one. When we require more parking, we not only make development more expensive, but we incentivize more sprawl and we incentivize people to use their cars more because they have easy access to parking. And finally, subdivision regulations are a good opportunity to improve both existing neighborhoods and plan for more walkable developments in the future. And this is one that has a lot of relevance to the suburban communities as well. So these would be requirements when a subdivision is created that requires grid street patterns. It requires short block lengths, connected and continuous active transportation infrastructure, and having a mix of destinations would all be examples for that. So Nashville, Tennessee is an area that has some good subdivision regulations from their Metropolitan Planning Commission. So these establish the standards for their walkable subdivisions in urban areas. So they have requirements about how long blocks can be, where sidewalks need to be installed in all subdivisions. They have requirements for how their street patterns are, and then provisions for pedestrian and bicycle access. So in this particular image from their code, this is what might be considered your more typical cul-de-sac development. But in the back, you can see that there's pedestrian pathways and sidewalks leading up to the back of those cul-de-sacs. So somebody can actually walk out the back of a cul-de-sac to access another area that's on the other side, rather than having to take a much longer route, which they might not do and might decide to drive instead. Pedestrian and bicyclist safety is another urban health issue. Perceived safety is a major reason that people don't walk or bike. This might be due to infrequent marked crossings, wide corner radii at intersections which cause cars to turn faster, limited or no sidewalks or sidewalks in bad conditions, or a lack of separated facilities for biking. All of this can create a hostile travel environment, which favors motorists and endangers people who are walking and bicycling. So some of the tools for these, there's a lot of other resources out there, so I won't go into too many details, but installing bicycle and pedestrian infrastructure is pretty much the biggest way to promote more walking and biking and make it safer, and then also doing traffic calming and road diets to reduce vehicle speeds, reduce conflicts with vehicles, and make it just a more pleasant environment to walk and bike. Traffic injuries and fatalities, not just for people walking and biking, but for people driving as well, are also a major urban health issue. In 2017, 37,000 people around the country died in traffic, and highway crashes cost Americans an estimated $242 billion annually, which is just an invaluable number. The injuries that can be caused here can prevent long-term physical and mental health, but better roadway design and policy and regulations could reduce those numbers. So complete streets policies are something that communities can put into place, which really make it automatic to consider all modes when you're planning for roads and transportation. Vision Zero plans are also something that a community consider. This Vision Zero is a strategy to eliminate all traffic fatalities and severe injuries while increasing safe, healthy, and equitable mobility for all. So under a Vision Zero framework, you assume that crashes are preventable, that people make mistakes, but they shouldn't be deadly, and that saving lives really is not expensive. So incorporating a Vision Zero plan into a community's transportation plan or as a standalone document really shifts the thinking about how to deal with traffic injuries and fatalities. And then enforcement, just a word about enforcement. It is an important part of reducing traffic injuries and fatalities, but there are enforcement tactics that can perpetuate racial profiling and increase inequality within communities. So thinking about things like speed camera enforcement might be a better way to go. Limited access to green space is another big one. In urban areas, building green space can be cost prohibitive. There can be a lot of development pressure when there's an empty site to fill it in with a building rather than with a green space. And there might just not be space available in some of our most dense areas. And this is problematic for environmental health and for mental health. Having green space available is a really important feature of cities. So some of the tools that can be considered would be development guidelines that require green space for development of a certain size, and developing things like pocket parks and parklets in an area where you might have more dense development, but you can still save some of that space for a little oasis of green. And then vacant land reuse can be really important for, again, taking those empty lots. And you can also think about facilitating side yard programs where where vacant lots next to a house or another building are made available for purchase at a really, really low price, and that the house next to it would maintain it as a more sort of open green space. And then thinking about the siting of parks within a community is an important part of this as well. So there's a big need for the more small and dispersed parks so that everyone can walk or bike to a park and has really easy access rather than just, a few landmark parks that maybe you can't get to easily. One case study for this example is here in Columbus again. In 2016, there was a competition called the Parcels to Places project, which looked to transform vacant land bank lots into community green spaces and to fulfill other needs. So this picture is of a park in Old Town East that was developed on an empty lot, and they built a little pocket park to add a much needed green space into the neighborhood. Housing instability is another one. It wasn't on that original chart, but it has a really big effect on personal health. When families can't afford housing at market rates, they then have to live often in substandard housing, so they might be exposed to mold or lead or other health risks. Or they might have to live in crowded conditions, which can really affect mental health and your relationships and just your ability to sleep. Foreclosures on homes can lead to future housing instability. It can force families out of their communities into ones that have higher crime rates or more environmental contaminants or fewer services. So housing instability, especially early in life, can play a big role in your future health. So some tools to address housing instability and affordable housing. First of all, just building more of it. This can be done through local housing authorities and nonprofits. Inclusionary zoning is another tool to promote affordability. So this would be a zoning requirement that new developments have to have a certain percentage of units that are available at affordable rates. So this could be done, it could be an outright requirement, or it could be an incentive to do so.
Sally, we only have about 4 minutes left. I'm sorry.
Oh, okay, upzoning would be another tool. So that would be allowing a greater mix of housing types, and then thinking about age-friendly communities and the types of housing that support older adults. So one example is in Minneapolis, Minnesota, where they took a big step to promote affordability in their city by upzoning the entire city. So they removed all single-family zoning and allowed multifamily housing in all residential areas. So it'll be really interesting to see what happens with this new policy. So we've covered a lot of ground. We're almost out of time, so I want to just touch on implementation and how you can be more involved in land use decisions at the local level. First of all is to do your research. Assess what you know about land use in your communities. Is there a comprehensive plan? When was it updated? Who do you need to talk to, and when do they meet? Which will help you identify opportunities for public input as a public health professional. Another is to start or build relationships and really figuring out who's making decisions about land use and learning how to talk to them in their language, a lot of which all of the resources I've mentioned before can really help build that understanding. Engaging your NPOs, so we've talked about this a little bit, but there's 17 around Ohio, and they control a lot of money, a lot of transportation funding, and they also can help make important connections for collaboration between different jurisdictions, which is really important when you've got cities and suburbs that are trying to work together. And then get involved in influencing the locations of community facilities. So this is a big investment of public funds, and they need to be used in a productive way to promote healthy transportation and decisions. And finally, expand engagement. So really the people in urban areas are one of their biggest assets. So making sure that all the voices in your community have the opportunity to participate and making it as easy as possible for them to do so is going to have a result of better decisions in your public decision making and land use planning. So I'm going to, we had one more question, but I want to make sure that everybody has an opportunity to put any other questions into the chat box that they'd like to address. So I think I will put this one up, this last question up. And then if folks also want to put any questions into the chat box, they can do so. But I just was interested in hearing any challenges that you face in your communities employing some land use strategies to improve community health. So if you've used any of these tools we've talked about and the challenges you faced or the successes you've had. And Victoria, if there's any other questions coming through at the same time. So the people who weren't able to log in before, the number should be up on the screen again.
Yeah, that number for Menti is 874675, and I haven't seen any other comments coming through yet.
Great. So yeah, not in my backyard is a big issue, especially in urban-suburban areas of people who don't want to see certain types of development, especially around affordable housing, happening in their neighborhoods. Zoning regulations. Yes, so suburban models being applied in urban areas. So having a sort of generic type of land use regulation that isn't really applicable to a more urban area. A lot of the things that we talked about, the healthy foods overlays and things like that, making things a little bit more specific to an urban setting is a really important change to make. Facing challenges, encouraging walkable development and zoning for it.
I want to be cognizant of people's time commitments, and we are at the 1 hour mark, but we're happy to keep going if you want to hang in there. So Sally, however you'd like to wrap things up.
Yeah, I just wanted, again, I'm going to share out all these results from Menti, so if people have other thoughts that they want to put into there, we will share them afterwards. But thank you all very much for coming, and the PowerPoint that's going to be available afterwards as well has links to a bunch of resources that you might find useful. So please feel free to get in touch as well if you have further questions, and get in touch with your local CHC coordinators and ask them to share some of the resources that they've received as well.
Sounds great. Thank you so much for presenting the webinar. We appreciate it very much, and hopefully the recording will be successful and we'll get that out to everyone. So everyone have a great rest of your day. Thank you.
Thanks. Bye-bye.